And we're happy to have Dr. Adam Payne, a licensed psychologist from the Center for Cognitive and Dialectical Behavior Therapy. He provides individual dialectical behavior therapy as well as CBT and runs a skills group there as well. Dr. Payne also provides intensive DBT training to clinicians around the country through Behavioral Tech LLC. I just want to go over a little bit about what we'll be doing today, and then I'll hand it straight off to Adam. So for our agenda, we're going to be going through what is DBT, why is DBT important, why is DBT important for transition-age youth, how you can implement this practice, and then we'll have a short Q&A session. So again, thank you all for joining us, and Dr. Payne, I'll turn it over to you.
Well, thank you so much, Jason. I very much appreciate being with you. Thank you to you and to Kara and to everyone at Community Technical Assistance Center. It's really very nice to be part of this series, the caregiver perspective, the youth perspective, and the treatment provider perspective in talking about DBT, which I do think is an appropriate choice for the series in that dialectical behavior therapy has made the leap from an adult treatment where it was originally designed to a treatment for adolescents very quickly. Within the first years of the treatment being around, it made the leap to working with families. And also has become widespread with regard to treatment of many different types of adolescent issues. And even increasingly within mainstream education, as the skills from DBT are being introduced into health classes, as well as being provided in school settings, and with greater data behind the provision of services in those settings, as well as to different diagnostic groups as well. And so having that skills component is very attractive to clinicians and educators, as well as parents and caregivers. So I think it's a lovely choice, and I appreciate the invitation to present about DBT today. DBT these are some of the things that we'll talk about here today. What is DBT? Dialectical behavior therapy is a cognitive behavioral therapy. It was originally designed for the treatment of borderline personality disorder, for which many of the hallmark characteristics are suicidal behaviors and self-harming behaviors. And indeed, as Jason pointed out before, those of us that provide this treatment will often work with our adolescents and young adults individually, in individual therapy, as well as providing skills training classes, skills training groups, and I'll be talking a bit about the skills that we teach within those modalities. But before I even, here's our thing. We'd like to find out some information from you. Trying to find out how many of you may have had some prior experience with DBT and may be providing DBT within your settings, or how many of you for whom this is a real introduction and a first step into the wonderful world of DBT?
So please feel free to pick one of the poll answers. You should see a box appear on the right side of your screen, and we'll give everyone a minute to answer. Thank you.
right, here we're getting some responses here. Okay, so I see 6 of you would say that you have been providing DBT in your current practice. 8 of you would say somewhat. 12 say no, and people haven't had their answer recorded as yet. But I look forward to speaking with all of you and hopefully bringing something of the skills that we teach to your practice, whether you've had some prior experience with DBT or whether this is indeed your first orientation or introduction to it. I particularly like this quote from a TED Talk, and while I don't in any way pretend to be a great leader, I do see how this quote speaks to taking the opportunity here to try to talk to what people most care about. Why do we do what we do? Why does a person gravitate towards DBT when you are a clinician or a treatment provider? What is it that pulls someone to be part of this treatment? And I think the answer is that it's a strength-driven treatment. We really do believe that teenagers are awesome. DBT very much takes the perspective that we're going to focus on the strengths of these teens and young adults. And in particular, this idea that emotions, which many see as the bane of existence, we're going to see as a great gift, perhaps even as a talent that folks have. We know that emotions are very much part of each of the things that you're going to see coming onto your screen at this point. Many of the teens and young adults that we have as part of our treatment program at our center here on Long Island will have these characteristics and these traits. They are often folks that are artistic, that are theater kids, that care very much about their friends. These are the folks that will lead within their schools sometimes, trying to get injustices righted, and who care very much about those that are marginalized or disenfranchised. Their passion is really there. And yet we absolutely know that while our perspective and while we try to help our teenagers to understand that emotions are not their enemy, we also very much know that emotions, when they are as intense and as powerful as they can be for many of our teens, can be painful and scary, and can be then related to impulsivity and the dangerous behaviors that then follow when folks get impulsive. And this is true for teens both with and without psychiatric diagnoses. Emotions can be very difficult through the adolescent and young adult years. It does indeed take a village to then address these disorders or the emotions themselves, because we know that the power of emotions are related diagnostically to things like borderline personality disorder, which was the diagnosis originally the DBT was originally aimed to treat, as well as these specific behaviors, the suicidal and non-suicidal self-injury, eating disorders, substance use disorders. It really does take a village because these are so powerful. And in case you perhaps had the thought and the hope, which I sadly will dash here, that like things like teen pregnancy and other things where societal impacts have made a difference, these lines look awfully horizontal now, don't they? Unfortunately, suicide rates have not made a very big change over the past 2 decades. I mean, if you are squinting at your screen, you may say, but Adam, I see that line is sloping downward, that blue line at the top is sloping downward a bit in the 90s to 2000. And you would be right. Adolescent suicide rates did actually show a start of a decline during that time, but as you can also see, if you continue your squinting, they've come up a bit since then. And in fact, in the last decade, the Center for Disease Control data comes out little by little. Rates of suicide for older adolescent males for whom, unfortunately, firearms has been the main reason why they succeed in completing suicide, and younger teenage girls who, unfortunately, are hanging themselves at a higher frequency rate are what contributes to the fact that, unfortunately, these suicide numbers have gone up again somewhat in the last decade. Similarly, just to point out this idea that we just can't wait for things to get better. We can't wait for societal impacts to make the difference. If you look at the middle column, middle row, this is talking about eating disorder behavior, which also has a strong emotional component behind it. And as you can see, other than this little curious dip in 2001, these are teens who were surveyed themselves here in New York City. They took a survey on whether they had engaged in these behaviors, and at least from the teen perspective, they're rather consistent in the rates of eating disorder behavior that they are self-endorsing on this survey. And sadly, if you look a little further into the data, you'll look down to that bottom row and you'll see that all the male rates of self-report of eating disorder behavior starts very low. Look at these last couple of years. I wonder whether we're going to see a big burgeoning of male patients who are coming to treatment with diagnoses of eating disorders. As you can see, they are self-reporting at a higher rate. Whoops, one more slide here, I believe. I think I went a little too fast. Similar idea, that these are the same self-survey of teens in New York City where you offered, sold, or given an illegal drug. Same basic premise here. Sadly, these numbers are very high, and sadly, they're not decreasing over time. Well, so we then go to the idea of how are we going to treat some of these things, given that the societal impacts are not having their immediate change the way that we might hope. And Marsha Linehan is the woman who then is a treatment developer, and she has been, over the past several decades, the treatment developer in its ongoing development of dialectical behavior therapy, or DBT. She's out west, where it's just getting the morning started out there in Seattle, where she is a professor at the University of Washington. And indeed, perhaps she is also the right person to have been the treatment developer for a treatment focused very much on emotions, given that in a New York Times article several years ago, she talked about her own struggles with the power of emotions. Clearly, her emotions have led her to be a leader and creative and passionate, and yet she too certainly understands in a very immediate way how emotions can be painful. And so she has been developing treatments for these powerful emotions for the past decades. And what's interesting is that I'll point out how she came to some of the things that make DBT so unique. This is another person of note within the behavior therapy world. He's a little bit more local, Marv Goldfried out at Stony Brook out on Long Island, who worked with Marsha back in the day. And for those of you who are perhaps new to the field or younger folks yourselves, you may not find it so seminal or so shocking or so innovative, the idea that psychologists or therapists in general would have teaching as part of what they do within therapy. But before this work in behavior therapy some time ago, where Marv Goldfried worked with Marsha and other folks, insight was the only mechanism of change that psychologists really focused on. And while I've got no problem with insight, obviously if someone can understand their behavioral patterns or understand where their emotions are coming from, this can only be of help. We're just adding on to that. The idea that what we can do as treatment providers is teach these emotional teens what to do with those powerful and intense emotions. And so expanding our role to the idea of teaching, which is very important within DBT. How so? DBT is very much a comprehensive treatment. It is thought of as a program that our teens attend. Now, I certainly hope that those of you that are primarily and only independent individual clinicians won't log out of the webinar at this time. certainly some of the things that we do programmatically can be done within an individual therapy context. However, DBT was designed as a comprehensive treatment which has several modes, four modes in particular. DBT skills class is the backbone. That's what helped people to really feel like you're in a DBT program. Let's see if I can use my mouse to go forward one here. Our second mode is the idea that while our teens and our young adults do attend skills classes, they also have an individual therapist. They go to each of these one time per week. Skills class once per week, and individual therapy once a week. This is the brain. So what we learn in the skills class, that backbone of skills that we're going to learn, the individual therapy has to think and figure out how is it going to apply to this particular individual and this particular individual's situation in life, which helps it to be very culturally independent, because wherever you're coming from, the individual therapy is going to try to fit the skills to your particular life experience. Our third mode is that DBT therapists are involved in phone coaching. This is the blood. It takes the skills around the person's life. So we will actually coach our clients when we're on the phone with them for how they can apply the skills in individual moments within a person's life. And because we are human beings too as clinicians, because we have emotions too, the fourth mode of DBT is that in a full comprehensive DBT program, we meet as a team. We meet as a team also once per week. This is not to talk about what to do with the clients or how to make the treatment go forward in a particular individual's case, as much as it is letting the therapists address how they are going to manage their own emotions, because dealing with suicidal behaviors or dealing with difficult, impulsive behaviors is anxiety-provoking for therapists themselves. How to address the emotions of the therapist and how to get the therapist to become more skilled in their provision of DBT. These are the four modes that we do in a comprehensive program, and that if you're an individual person, you'll try to find ways to accommodate all the things that happen in these modes within your particular situation. In our skills class, this backbone, for adolescents, the standard has become a multi-family skills group. So we'll have 6 to 8 families together. So we have a pretty big room in our center here on Long Island. We are following the ideas first put forward by my buddies, Alec Miller and Jill Rathis. And so the parents and the teens are in the group together, and it's a class. And so we teach this class together. The parents and the teens are equal members and asked to practice the skills themselves each, not just the teens. We teach all of our skills once in 6 months. It takes us 6 months to go through our curriculum. And Marsha Linehan has designed DBT to be repeated. You hear the skills the first time, and you really make them your own the second time. And so it takes a year to go through a full course of DBT in most DBT programs. And as I point here at the bottom, the skills can be taught in individual therapy. However, the research is predominantly on DBT that is provided within a skills training class. All right, we've got our folks, we've got our teens, and they do have these wonderful, powerful emotions that can be creative and artistic and empathetic, and it also can be impulsive and of great distress to them. So how does DBT start to address asking teenagers to learn how to pause before they rush into the impulsive behavior, before they get emotionally hijacked? And how do they simply reduce the emotional distress that comes along with having these powerful and intense emotions? So how do we do the pause? Mindfulness is the idea. Those of you who have even watched the Today Show and other kinds of things, you'll start to hear and see mindfulness creeping across our common culture here in the United States and of course, even abroad. Jon Kabat-Zinn is a person who started mindfulness. He's not a DBT therapist. He started mindfulness with patients with chronic pain up in Boston and using mindfulness as a way to help them with their chronic pain symptoms. Marsha Linehan then brought mindfulness into psychological treatment. And as you see in her definition that mindfulness is very much about learning how to control your mind, control your emotions, rather than letting your mind or your emotions control you. The idea that we are looking to find some way to help our teens and our young adults to not become emotionally hijacked, which might make them rush into those impulsive behaviors. And so here's one of the skills that we teach in our skills training class. This idea that we are hoping that our teens and young adults and our parents and ourselves will be able to attain wise mind in the process of decisions we have to make and when we set out for a course of action or have to react to situations as they come upon us. We talk about the idea that emotion mind is the state of mind when emotions make the call. This is when the emotions are at their peak and they're hot, hot, hot. This is the idea that if you're walking down the street and you enter that pet store, emotion mind is going to have you buy all the puppies. It's going to have you max out your credit card, pull back and get those puppies and put them all in the SUV because they're so cute. Because I can't leave them alone. I can't leave the one behind. It'll be lonely. And so the emotions make the call. And in my little example here, you're going to buy all the puppies. Reasonable mind is the opposite. Reasonable mind, you're making your decisions based only upon cool logic and reason. This is the Star Trek Mr. Spock. This is when you go into that pet store, only focusing on the facts of the matter. How much it costs to have a puppy. How many times you have to take it to the vet. Pooing and piddling on the rug. And my big reason for not having a puppy right now, which is blizzards in New York. And how I'm not going to want to be walking that dog in a blizzard in February. And so if I'm only focusing on reasonable mind, I'm not going to buy any puppies, none at all, because I'm only focusing on that factual side of things. Wise mind is the integration of both emotion and reason. This is so important for our very emotional teens. We can't tell them to not have emotions. They're going to have them. We want them to use their emotions. Perhaps we would say, though, that a wise mind is best and most needed when emotions are high. Some people think that mindfulness or meditation is getting this calm Zen state. And what we're saying is, not so much. We need to be able to get to wise mind, to bring the reason side in during the times when we are most emotional. When our best friend has gotten us right before we're heading into the classroom and says, your hottie was just kissing someone underneath the bleachers. And your emotion mind says, leave that class even though you've got a big test and run to the gym and confront your hottie about what is going on underneath those bleachers. Or maybe less humorously, when those emotions might pull someone to want to take a drug or an overdose or hurt themselves in some way. And so we talk about the idea of developing this idea of wise mind, and I think we're going to come to a bit of a video segment. It's just about a minute. If you want to get it set up, go right ahead. I'll get it set up as we're talking, where I got a good friend of mine here to demonstrate what just a minute of a DBT class might even look like in talking about how this reasonable mind, wise mind, and emotion mind might work. You can go ahead. All righty, and I don't have sound on my end. I don't know if you've got it on yours. I can see, but I cannot hear. I don't know if you can.
Okay, sorry about that, everyone.
So thank you for bearing with us, everyone. We are experiencing a little bit of technical difficulty, but we'll have that video up and running in just a few seconds for you. Just a little bit more time, everyone. We do apologize for this delay.
It's going to be so good when it comes, though. And we could do the yoga version if we have to. The video that I sent these dear folks, for some reason, kept wanting to flip upside down. And so I did suggest the possibility that this might be a chance for everyone to get up and stand on their head in yoga mode. Well, here we go. Out on right side up.
So, if the idea is, if you're with me so far, that it's not that emotions are the end, but that when we're making decisions, we want to be able to take information from our emotions and information from our reason, so that we can combine them to get the best information to make our decisions and choices for wise. You may then turn to me and say the following: this is emotion and this is action. It feels like this. Emotion, action. A lot of people will say that they feel like they're just rushing in to do that impulsive. Mindfulness is saying that we're going to try to learn different skills in the way to have emotion, pause, and choose the action. Hopefully something is in line with your mind. So the next bit of skills is what skills and how skills. Get us to wise mind. Setting emotion, what skills and how skills you can have change.
So thank you, everyone. We apologize for that delay. If you were unable to hear the video, we will post it on our website, ctacny.com, with the slides as well. We do apologize for that.
Awesome. That's great. Thank you, Jason. So my friend that I got to do that, if you could figure out that voice, it's actually me. Hopefully I'm my own good friend. So what I was setting up there was this idea of the what skills. What is wise mind? And this idea, if you could see with the snaps, that instead of it just being rushing in and no pause at all between emotion and action, that what we are trying to do is to develop the adolescent's ability to have a pause before they rush right in, before they are emotionally hijacked. And so that if the one snap is the emotion, then you saw me go up and down the other side with maybe not just the impulsive action, but instead a choice. And so what are our three what skills? The first what skill is the skill of observe. And so what I'd like to do for this, Jason says that we have this potential, is I'm going to get one of you, it's going to be randomly done by the computer, one of you is going to get your voice actually projected into our webinar, and I'm going to ask you to tell us an embarrassing story of something that's happened to you at some point in your life. I need this story. So we're going to go ahead, Jason. I'm just kidding. I'm not going to do this at all. That's not at all. I'm completely faking you out. Now, I don't know whether any of you actually noticed any surge of emotions when you thought that potentially you might be put on the spot in this way. This is what we want our folks to be able to develop, is the understanding and learning what makes their emotions surge, and to notice that surge. Because if you can watch the surge happening, you can pause. If you get that surge as it's in process, you're watching the surge without reacting. And so, I don't know whether some of you noticed a surge of anxiety. Maybe I'm going to be the one who was called. Or a surge of anger. How dare he do this? We weren't told about this. Now, I'm actually not concerned about which emotion yet. The observed part is just the surge. Now we're on to the name. The describe skill is where then we try to figure out, well, what emotion is it? Was it anxiety? Was it anger? Because what we would say is, if you know what you're feeling, that's a pretty important step to be able to manage what you're feeling. And if you've got a lot of an emotion and you don't want to get hijacked by it, name the emotion. Know what that emotion is. I did a training in California a few years back, and a woman raised her hand at this point when I was talking about this, and she said, is it kind of like this? Because I learned it this way: name it, claim it, tame it, when she was talking about emotions. And I said, that is just beautiful. That's exactly what we're going for here. If you can name the emotion, that can help you to claim the emotion. And then, of course, what we're looking for is not to get rid of it, certainly, however, to tame that emotion. The skill of participate is our last of our what skills. And this is what asks our teens and our parents and all of us to practice being in the moment you're in. For those of you who know mindfulness, you'll know that this is a very hallmark characteristic. Knowing how to be in just the moment you're in. How does this relate to emotions? Because as we know, the things that can often rev up our emotions are the regrets of the past or the anxiety and worries about the future. A real good way to get caught back into emotion mind is to let one's mind go back to the past or the future and these regrets or these anxieties. And indeed, if we can practice being just in the moment you're in and fully being in that moment in the zone, that is a way to stay in wise mind, to not get hijacked, to not add on to what may already be in the moment by adding in the past or trying to add in the future. So what do we try to do here? Me teaching the teens this is not nearly enough. Every single week in our class, or every single week in my individual therapy, we have exercises to practice these kinds of things. We have exercises where we watch an itch that we may have, or focus on one item and notice when our mind wanders, or do a difficult puzzle and notice that surge of emotions that comes up. If you Google mindfulness exercises, you will find all sorts of resources online for different exercises, but the idea here is that it isn't just understanding the what skills, it's very much practicing the what skills. It's a skill that develops over time and with practice. So we do it every week. If we're successful and help our teens to practice learning how to pause, we still need to help them to reduce their emotional distress. So how do we do that? James Gross is a professor out at Stanford University, and he has a model of emotions. If we're going to help our teens with our emotions, we need to understand emotions. And so this is his model of how people, teenagers too, of course, regulate their emotions. Well, what does he really mean here? How do we help our teens to make choices? How do we help them to do problem solving so that they can find solutions that will help them to decrease the intensity of their emotions? How do they turn away from triggers, like that teenager who has to turn towards her class rather than run to the gym to confront her hottie? How do we help our teens to avoid extreme thinking that might otherwise increase the intensity of their emotions or change their action tendencies? We know that even though it is common in our culture to think that if we vent out our emotions, they will somehow get better or decrease, that for many, many years we've actually known that the more you vent, the more you feel that emotion. We've got to change our action tendencies. And so this is another way to say this. How do we help these teens? This is just the written out version of that last slide. Adding on to it that what we are going to talk about a bit in addition is using the physiology, the biology of our teenagers to their benefit to also help them to reduce their emotional distress and the intensity of those emotions. These are then the skills that we may apply. So this is that same model taken from a DBT perspective. There are skills that actually, the ABC please skills are skills that we talk about how to help a person to be less vulnerable to emotions in the first place. If you see Marcia's manuals, you'll get more details on these. Certainly we teach our teens problem solving and how to become better problem solvers. There are steps in problem solving that one can learn. We've talked a little bit about the mindfulness skills that help a teenager to gain control of their mind so that they can have their attention better focused on what they really need to be doing in this moment. And we have skills that we call distress tolerance skills. Dialectics is a way to help thoughts not be so extreme. And since it's in the name of the treatment, I wanted to introduce you to it too. And we have skills for dealing with the action tendencies. That skill will be called opposite action. So here's a simplified model of emotion, which is pointing about the idea that, although it may not look so simple at the beginning, that the emotion, if we're going to help a teenager with it, is not just sadness or is not just anxiety. It's a full system response. That our teens are going to have thoughts, body sensations, and actions, and we consider them all part of the emotion. This, of course, is kind of good news, bad news, because it does feel actually, even in the simplified model, somewhat complicated. The good news is, if you want to change the emotion, there's a lot of arrows pointing towards that middle box. If you want to change the emotion, there are many places where you might be able to intervene to help that teenager to change their emotion. So where do we start? Let's start with thoughts. Dialectics is our idea here. It's in the name of the treatment. Complicated little definition up here up top. I like the bottom one a little bit better because what we're going to do to help our teenagers to not let their extreme thoughts further rev up their emotions is to teach them this idea that if you can honor the truth in both sides of a potential conflict with a teacher or a parent, if you can honor both sides, you can keep yourself from going to the extremes of the thinking and the extremes of the emotion. So what's an example that we could do here. Imagine that you have a teenager who's been invited to a party. And the teenager wants to go to the party until 1 a.m. Okay, so far so good, except that mama wants this teen home at 10 p.m. It's a very conservative mama who wants that teen home at 10 p.m. Uh-oh, we could really get stuck here. You can imagine if you can, maybe you've had this example in your own family or with your clients where emotions could then get very high from this very stuck place. And indeed, I'll point out that I don't think either person would be satisfied with what we would consider the compromise of 1130. Dialectics really are not, even though we sometimes call it the middle path, it's really not intended to just be a compromise. It's intended to say, how could we honor what is really true about both sides? Well, what is really true about the teen side? Why do they want to be out until 1 a.m.? Let me get you thinking here a little bit. But I think the most idea is that that teenager wants to be out until 1 a.m. so they don't miss out on things. They don't want their friends to be out doing stuff, and they don't get the chance to be part of it. That's the essence of their side. What's the essence of mama's side? Mama wants safety. Mama wants that teen home because nothing good happens after 10 p.m. And so mama is concerned about that. And so the question is, how do we use dialectics to honor what is true about both I don't want to miss out and I want to be safe, to get a solution that isn't just in the middle, because no one's happy with that. 1130 doesn't get safety and the teen still gets missing out. How do we get a better idea? So I wonder what your thoughts are. I see my time going along zippy, especially with our little technical glitch there, but I at least want you to take this moment and think a little bit about what would be a solution that would honor both sides. It would honor the teen not having to miss out and would honor the mama's desire to make sure that their teenager is safe. Potentially, it could be this. These are, I actually literally taught this skill last night in my DBT skills class, and these were some of the ideas that they came up with. They often come up with the same ones. Maybe the teen gets to go till 1 a.m., but that teen needs to check in with mama regularly. For some families, that actually honors both sides. For some, they get to go till 1 a.m., but the mama picks them up, because what that mama is really worried about is the driving out there with the potential drunk drivers out there late at night. Or goes till 1 a.m., but takes a cab home instead. But maybe it's that the teenager has to be home at 10 p.m., but so that they don't get missed out, the teenager invites their best friends back to their house. And sometimes the parent is going to say no entirely because they know that there's yucky stuff going on at that party. And still, to honor both sides, the parent makes the effort to arrange another time where that friend, where that teen can be with their friends. Are any of these perfect things? Does either side get exactly the fullness of what they want? Not necessarily. But when you teach families to try to solve problems dialectically, they may be better able to keep their emotions in check. And if they do so, they're going to be less impulsive, they're going to have less conflicts and less friction. And so literally taught this skill in my group last night, and these were some of the same ideas that some of my teenagers and their parents came up with. Getting them to think less in extremes and more in this dialectical way. Well, we have other arrows that we could help. If we want to help these teenagers to decrease their distress and intensity of their distress, we could focus on their actions. We said before this idea that action urges could go along with intense emotions. And so these are, I have two slides that are actually a video still. So this actually isn't a video, this is a still from a video that put out by Behavioral Tech, which is the training company founded by Marsha Linehan herself, and that I do my DBT trainings for. So this is the training company that Marsha is involved with. And they put out a video talking about these skills to try to teach them as well. And so this is a still, which points out that if you give into the action urge, if you see the way that these wheels spin, the emotion will create an action urge. That's that top arrow. And if you give in to that action urge, it will spin that wheel and further spin. And these arrows go back and forth, back and forth, back and forth, back and forth. The more you give in to the action urge, the more the emotion increases, as opposed to what we teach the teens and their parents, is to realize what the action urge is, and then this green arrow. Instead of that wheel spinning, that gear spinning clockwise, if you do the opposite action, it hits the gears. It grabs those gears in the backward way and slows down the process. It doesn't allow that emotion to further rev up. And so we talk about the different action urges. If a teen is invited to that same party, but they're anxious about it, they might avoid the party. And although they get immediate relief, every time they get invited to something new, they continue to have that action urge to avoid, and their anxiety actually goes up. Many of you have probably had this experience with sadness as well, that the action urge of sadness is to withdraw, to pull the covers over your head. And I don't know if you've had the same experience as me, but when you do that, you feel worse. You just feel further into your funk. Even though the action urge says just pull those covers up and go back to sleep, you usually feel worse later on that day. The opposite action, get active. And probably you've had that experience that if you get up and get moving, get out of the house, get to the mall, just go do something, that usually people will actually have a decrease in their sadness. They'll actually feel better. Anger, the action urges to attack. And as I said, if you vent out your stuff, people think that that's going to make them feel better. Usually when you attack, your anger actually goes up. What's the opposite action? Gently avoiding, gaining some empathy for the other person. Avoidance being your first step, but if you can really get as far as to see life through that other person's eyes, that's certainly the opposite action to attacking them. Your anger is likely to go down. This is the idea of opposite action. To change your actions, to change your emotions, which for a lot of our teenagers who feel their emotions just happen to them, this is a very novel idea. All right, last but not least, our body sensations. How can we use our body? I pointed out before, I wanted to make sure that our teenagers know how to use their biology, their physiology, to help them to reduce the intensity of their emotions too. And yet we have another arrow here pointing in towards the emotions. These skills are some of the newest and most favored skills of many clinicians and many of our teenagers too. They're called the TIP skills. These are using your biology to have an impact on your, let's get biological here, parasympathetic nervous system. For our biologists in the webinar here, you have two nervous systems that run up and down your central spine. You have the GO system, which is the sympathetic nervous system. Fight or flight, get moving. That shark's coming, go, go, go. Fight or flight. Right alongside it, there's a parasympathetic nervous system, which is the one that is the slow system. Slow down. Digest your food. Relax. Get some sleep. Work on creating some hormones. And we can find ways to get this parasympathetic nervous system going, even in the midst of powerful emotions. And I have a video here. Go ahead, you can start it. This, I think, is embedded within. From YouTube, if you YouTube Dive Reflex, you will find these lovely young children from New Zealand who came up with this video that's going to teach you guys.
Today we learn about the adaptations of seals, and we also learn about the mammalian dive reflex. The mammalian dive reflex is when mammals go inside water, their heart rate goes down. This happens because if your heart rate goes down, you don't use a lot of oxygen. If you don't use a lot of oxygen, you can stay underwater a long time. When humans put their face underwater at 21 degrees or lower, their heartbeat drops by 25%. Seals' heartbeats drop even more, from 125 to 10. Okay, so today we wanted to try it. So Mr. C got a heart monitor and a bucket of water. Firstly, we tried it out without our head in the water, and then we tried it with our heads in the water. Wesley will show you how we did it. So
All right. Cold?
his result was 63, and
And so I actually show this video in my groups, and some of our groups will actually bring in some water and have our families practice. And you're thinking, really? You get teenagers to do this? Absolutely, we do. Maybe it's because the New Zealand kids are so cute. And this little thing here shows that for every kid, and these were not kids who were revved up and emotional first, their heart rate declines in every case. And so indeed, you can Google that, or YouTube actually, that dive reflex video to see it again if you like. It's on the first page of Dive Reflex. And so like I say, we're trying to look at all the different ways that we can help a teen to get regulation of those emotions so that they don't feel the pain and the intensity of the pain. And so we teach them that skill. And it's one that if I am doing phone coaching, I may very well be on the phone and guide someone through that, putting their face in a bucket of coldish water, or even grabbing a bag of peas from the freezer and putting it on their face as a way to stimulate this dive reflex that gets the parasympathetic nervous system going. If you remember the tip skill from a couple of slides back, one of the P's stood for paced breathing. So this is not the same as diaphragmatic breathing. It's as simple as breathing out to a longer count than you breathe in. Doesn't have to do as much with the diaphragm or where your belly is and such. It's basically syncing up your breath with your heart rate. Pretty simple. If you want a little bit more complicated version of it, we can do that with the next slide, if the mouse is my friend. Milton Brown is a psychologist out in San Diego who is one of the biggest paced breathing guys, also called resonance frequency breathing. And although it is lower abdomen, really the emphasis is on exhaling longer than your inhale. You can see some of the other things that they suggest. What is it doing? By slowing down the breath, but really having this idea that you breathe out to a longer count that you breathe in, where before that, at a more rapid breathing and an intense, you see this wiggly line all over the place, nothing is synced up. When you slow it down and get to this about 5 breaths per minute, you sync your breathing with your heart rate. And what does that do? Well, maybe you won't be so surprised, because what that does is it stimulates the parasympathetic nervous system. The same thing that the dive reflex. It kicks in the slow system and helps a person, even in the midst of being really revved up, getting a bad text message or being yelled at or having another teen tease them. They're in the midst of intense emotions. They can use these strategies to click in the parasympathetic nervous system as a biological reaction by doing these skills. You can imagine a teenager doing this in a classroom where maybe something hasn't gone so well. You can do paced breathing just about anywhere. I know we're coming to the end of our time, so just to give you a little review of where we've been through, the idea that different skills can address the middle box through these different pathways. We teach these in a curriculum to our teenagers throughout our 6-month curriculum that we then repeat. But remember, we still have the other parts of this treatment. And I'll focus here on the brain part, that individual therapy. The idea that what the individual therapist then does is try to apply these skills to specific situations. The individual therapist will use a strategy called chain analysis. This is how to make the skills personal. Perhaps this individual, this teenager, was up all night studying, but then was told that their boyfriend was with another girl. Their immediate reaction was to become furious. Then they felt worthless and betrayed and started having thoughts about suicide. Instead, they cut their arm and stomach, but then their family found out about it, and because everyone was so upset, the consequences were that they were then brought to the emergency room. They do have now scars. The parents are upset. There are consequences to what happened in this blue circle, which is we call the problem behavior. So think about all those skills that we just talked about earlier. The idea of the individual therapist is to find links in the chain where these skills could be inserted. Links in the chain where those inserted skills might take this chain in a completely different direction. And instead of winding up at that blue circle with cut arm and stomach, we come out with a different outcome. So for perhaps we have our distress tolerance skills. If you Google distract with accept, you're going to see that we talk about different ways to distract yourself through activities, contributing to somebody else, comparisons, other emotions, pushing the emotions away, distracting thoughts or other distracting sensations. Maybe those skills could go with that link when the teenager is furious. Or maybe the teenager can use another distress tolerance skill, doing the pros and cons of acting impulsively and pausing. They're going to need some mindfulness there too, in order to engage in pros and cons so they don't rush in to the problem behavior. So we're towards the end of our time, and I do want to quickly thank Clinical Technical Assistance Center, the folks that I do all of my more formal and full trainings with, Behavioral Tech out in Seattle, and my own folks here in the New York area where I do all of my clinical services at the Center for Cognitive and Dialectical Behavior Therapy. So if we have time for questions and concerns, I'll do as much as I can and take any that may be outstanding. Jason, I don't know how this works.
Oh, well, thank you, Adam. I think the main question that we got is for clinicians who are beginning to utilize DBT or who would like to use DBT in their practice, what are some next steps or some resources that you could point their way?
Absolutely. You know, I think that the thing that is going to feel most usable and that you can actually take into your sessions would be learning these skills. Marcia has just come out with a brand new skills manual, so if you go to Guilford Press where it's published, or you can certainly buy it off Amazon as well, there is a brand new, hot off the presses within the last month, revision of some of her skills. A lot of changes to the worksheets and handouts that people will use within their skills training class. If you learn those skills, you can think about the possibility of running a group, or you could teach those skills to folks in individual sessions. Behavioral Tech has some online trainings also that teach those same skills, but I think that the thing that makes you feel like a DBT therapist is when you are thinking about how mindfulness can help people to make wise-minded decisions. So learning those mindfulness techniques and mindfulness exercises, learning the skills of distress tolerance, how to get through a situation without making it worse, and emotion regulation, how to change the emotions you want to change. I would send people towards resources that can help them learn the skills. I think that's going to feel really rewarding because it's going to be things that you would be able to bring into your treatment right away.
Okay, great. Thank you so much. And thank you all for participating. We are unfortunately out of time. I do want to take this opportunity to thank Dr. Payne for all of the resources that he's provided with us, but also a great talk today. And just to finish up, we will be posting the slides to our website, ctechny.com, as well as all the videos and resources that we did talk about today. We do have a number of webinars that are coming up for the end of the year as well as starting in January. So on December 17th from 12 to 1:30, we have Reimagining Children's Health Services Part 2, Gearing Up for Change. So that's an opportunity to really hear about what's going to happen with Children's Health Services and the changes that will be made. And starting in the new year, we will have the Adult Engagement Dissemination Project, where we'll be asking supervisors as well as clinicians to join us in a discussion about engagement and how we can really help clients stay within your agencies and really better utilize your services. So that's starting on January 12th, and you should see announcements coming out in the near future. So thank you again to everyone that has participated. All of the questions that are still coming in will be posted to our website with answers. So thank you and have a good day.
Thank you.